Hello, my name is Sonia Andrade, and today I'm going to talk about precision and predictive medicine. The purpose of this presentation is to use data to find whether or not the drug being tested is effective, to identify what medication has highest success rate when a patient is diagnosed with anxiety and has a substance abuse. The definitions of predictive medicine and precision medicine are the following. Predictive medicine is a field of medicine that entails predicting the probability of disease and instituting preventive measures in order to either prevent the disease altogether or decrease the impact upon the patient. And precision medicine is a medical model that proposes the customization of healthcare with medical decisions, practices, and products being tailored to the individual patient. So for question number one, we have to create a pivot table to calculate success. In order to do this, we are going to the data and then insert pivot table and then we hit OK and then we look for generalized anxiety diagnosis and we drag it to rows. So it is already there. And then we have to look for CIT success, which is one of the medications. And then that one goes to columns and values. And then we click on it and value field settings and we choose count and we hit OK. So then we have to find the rate of success, and in order to find this, we are going to divide 117 by 1366. And the rate of success is 0.32%. So let's go back here. So this is the formula we use. We divide C6 by D6 and then we obtain 32%. And because those are the patients who responded to treatment and the patients diagnosed with anxiety depression. And then we do the same, we follow the same process for the other medications. And then question number two is asking us which medication has highest success rate when the patient has anxiety diagnosis. The answer is CIT because it has the greatest rate of success with 32%. Then another question is why it is difficult to understand which medication works for patients with generalized anxiety depression. The reason for this is that every individual or person is different and as a result their body and mind reacts differently to medications. For example, some people may have bad side effects and others may not show any side effects to the medications. For question number three, we have to find the rate of success for drug abuse diagnosis. For this question, the same process is used, the same one we use for question number two. Only instead of using generic anxiety depression, as in the row, we use drug abuse diagnosis. So I go back to the data and then I click insert pivot table, hit OK, and then I find drug abuse diagnosis because that's the one we use here. And then we choose the same medication first, CIT, and then we click on it and we set it to count and then we find the rate of success, which is 36 divided by 115 and we obtained 0.31%. Let's go back here. And question number 3 is asking which medication has highest success rate when the patient has substance abuse. And BUP has the highest success rate at 38%. CIT is the second one rate of success with 31%. Thank you.